Here our topic is the heart of bovine and the different grooves that are present in the heart. The contents first of all, about introduction of the heart and the different grooves. The heart, it is a hollow involuntary muscular organ. It is placed in the middle mediastinum between the two lungs. The heart, it is asymmetrical in position and it is located towards the left of the median plane. Its long axis, it is directed downwards and backwards. For the description, the heart, it has a base, an apex, two surfaces and two borders. The base of the heart, it is directed upwards and it extends from third to sixth rib in case of ox or cattle, whereas it varies in other species like in equines, carnivores, etc. The apex, it is directed backwards and downwards and it is present opposite to the sixth chondrosternal articulation. Now coming to the borders, there are two borders that are present, anterior border and the posterior border. The anterior border, it is strongly convex and this border, it is formed by the right ventricle. The posterior border, it is nearly vertical and this posterior border, it is entirely formed by the left ventricle. So in this picture you can see this is the anterior border that is strongly convex. This is the posterior border. This is the anterior border and this is the posterior border. This part is known as, this is the base of the heart and this is the apex. Now coming to the surfaces. There are two surfaces present, left surface or auricular surface, right surface or atrial surface. The left surface is also known as auricular surface because the auricular appendix or the auricle is facing towards the surface, that is why it is called as auricular surface. While as the atria, it is facing towards the surface, that is the right surface, it is also known as atrial surface. Both these surfaces, right surface as well as the left surface, they are convex and they are marked by different grooves. The average weight of heart in case of ox, it is about 2.5 kg, that's 0.4 to 0.5% of their body weight. Now coming to the different grooves that are present in the heart, there are coronary grooves or transverse groove, and longitudinal groove and intermediate groove. Three types of grooves are there: coronary groove, longitudinal groove and intermediate. Now coming to the first type, that is coronary groove or transverse groove. The coronary groove, it indicates the division between the atria and the ventricles. And this coronary groove, it completely encircles the heart except at the origin of the pulmonary artery. Now coming to the longitudinal groove or ventricular groove. Because the longitudinal groove, they are present, separates the ventricle, they are also called as ventricular groove. Outside there are the grooves, ventricular groove, and inside there are septa, interventricular septa. So the first one, the longitudinal groove, it is paraconal interventricular groove or left longitudinal groove. This left longitudinal groove or paraconal interventricular groove, it begins from the coronary groove just behind the origin of the pulmonary artery, and this groove runs almost parallel to the posterior border. This left longitudinal groove, it lies opposite to the fourth rib and it lodges the paraconal branch of the left coronary artery and coronary vein. Now coming to the next type of the longitudinal groove, that is known as subsinusal interventricular groove or right longitudinal groove. This groove, it also begins from the coronary groove just behind the termination of the posterior vena cava. Behind the termination of the posterior vena cava, and it runs towards the apex and becomes continuous with the left longitudinal groove. The left longitudinal groove is opposite to the fifth intercostal space, while as its lower part it is opposite to the sixth rib. Upper part is opposite to fifth intercostal space and its lower part is opposite to sixth rib. The right longitudinal groove, it contains a subsinusal branch of the left coronary artery and coronary vein. And now coming to the another type of the groove, that is the intermediate groove. The intermediate groove, it is a shallow. It is present on the wall of the left ventricle. It contains the intermediate branch of the coronary artery. So these different types of the grooves, coronary groove, longitudinal groove, right or left, or intermediate groove, these different types of the groove, they are lodged with the fat and the coronary blood vessels. So here in this is the left view of the heart. So there are the four chambers. This is the right atrium, this is the left atrium, this is the right ventricle, and this is the left ventricle. So in between the two atria and the ventricles, there is a groove, that is this known as coronary groove. So this coronary groove, it completely encircles the heart except at the pulmonary artery. And this is the longitudinal groove, that is left longitudinal or paraconal interventricular groove. It contains paraconal branch of the coronary left coronary artery. So this is the left longitudinal groove. This left longitudinal groove, it begins from the coronary groove behind the pulmonary origin of the pulmonary artery, and it passes through the parallel to the posterior. This is the posterior border, and it passes parallel to the posterior border of the heart. So this is the base, this is the apex, this is the anterior border, this is the posterior border. Now coming to this, this is the right view of the heart. This is the right ventricle. Here this is the anterior border, this is the posterior border, this is the coronary groove, this is the right longitudinal groove or subsinusal interventricular groove. This is the right longitudinal groove. So this groove also begins from the coronary groove behind the termination of the, this is the posterior vena cava. So behind the termination of the posterior vena cava. This is the anterior vena cava, this is posterior vena cava, this is the right atrium. So right longitudinal groove begins from the coronary groove behind the termination of the posterior vena cava. And the intermediate groove, it is present on the left ventricle. It will be present here. Thank you.